This is BoomerLife on CL 650.
How do you sleep?
And welcome back to the show. We're talking about getting a good night's sleep. If you sleep better, you live better. That's the moniker the SnoreDentist Dr. Charnel Muir uses. Your practice is in North Vancouver.
Yes.
700
Marine Drive, corner of Marine and Bewick.
Okay. And the best way to get in touch with you is through your website.
Yeah. So the SnoreDentist.ca website, you can go on there. The phone number's there. You can book online. Even the email address, the info@SnoreDentist.ca.
And you're one of 2 people in the province that does this, is that right?
Yeah, there used to be a number of us. There used to be 5 of us, and 3 are now over the age of 80, I believe. Mm-hmm. The third one might only be 78.
Right.
So 3 of them, one retired, one is in the process of retiring, one just turned 82. So I'm not sure how close to retiring he is. Outside of those 3, there's 2 of us. Mm-hmm. Yeah.
And are physicians aware that you're out there? Because I would imagine someone comes in and says, I'm tired, I just have so much, I'm lethargic, I can't get through the day. And they would typically send them off to a sleep lab for CPAP.
Right.
But then this is another avenue.
Right. And I think part of the problem and one of my jobs really is to inform the physicians that not only is this available, but it's highly effective and recommended mm-hmm. for a vast number of their patients.
Okay, now, before the break, if you're just listening, we went through my home sleep test. I went to Dr. Muir's office, and we went through the results, and we're doing that again today, about how I sleep. And obviously, my wife tells me I snore, and I do have mild sleep apnea, and it's
right.
happening about stopping breathing 13 times an hour.
No, that was this.
The snoring was 13 times an hour.
We're only at 10 times an hour.
10 times an hour.
Yeah.
But that's still a lot.
Yeah.
It's every six minutes, right?
Right. Now, normal is 0 to 5, really. Right. But one of the things that's really critical is, when a patient such as yourself comes in and says, my wife she's going crazy, I snore, or my husband says I snore, because women snore too. Mm-hmm. So whatever that is, it's really important that wherever that patient goes, that they get a proper diagnosis and they don't just get treated for I think I have. So
right.
The patient come in and say, I only snore. What's your proof? You got to have the test. You've got to be diagnosed. And the job of this home sleep monitor is to get you the correct diagnosis so that then we can apply the correct therapy. And we're not just throwing darts with a blindfold on at the wall, hoping something sticks.
So with the home kit, then you go home, or you bring it back to your office,
yes.
or you can courier it back, right?
Yep.
So where does it go after that?
Right. So what my job is at that point is I download the data and I confirm that there is enough data on the study that it's valid. Mm-hmm. So we need at least 4 hours. So we ask patients to sleep at least 6 to 7 hours. Mm-hmm. We need at least 4 hours of data. I check that all of the leads stayed on, that we've got each of the lead data is going through. So
it's a good baseline test then,
so
right?
all of that is confirmed, and then that data is then electronically transferred, and it is read by what's called a PSGRT. So that is a respiratory therapist that has specialized training in reading sleep studies. Mm-hmm. They manually score the study because it'll have the auto score on it. So the computer will kind of roughly tell me
right.
what's happened. It'll be manually corrected so that that's correct. And then that then goes on to be interpreted by a specialist physician who then looks at the data. They look at the intake forms. They look at all of the pertinent information, and they come up with the diagnosis and recommendations. So their job is to diagnose and recommend therapy.
So this isn't you doing this?
No. And that's critically important, whether patients are being seen at CPAP companies, whether they're being seen by their dentist who happens to have a monitor in the back cupboard because they bought one at a one-day course, whatever that is. These studies have to be scored and interpreted by qualified medical practitioners. They can't just be treated based on what the computer says the patient might have.
And so what was the final outcome
So the final outcome was that there was snoring with mild obstructive sleep apnea. So then there's recommendations, and these recommendations are not in any particular order. They just happen to be there. So, for instance, conservative measures where applicable. So all of these conservative measures will apply to almost all patients. Weight loss, if that's appropriate. Some patients may want to consider weight loss as a treatment help. Stop smoking. Obviously, smoking irritates the airway.
Don't smoke. So.
Right. Keep away from alcohol after supper time, because alcohol's a muscle relaxant, and we all know we snore more when we drink. Avoid sedatives. So be careful with medications that cause muscle relaxation, because obviously airway is muscle and it's relaxing. Good sleep hygiene. Always. We want people to go to bed at the same time, awake at the same time, and get a fair number of hours of sleep. Often difficult with a traveler, right? So
when I'm home, I do sleep.
So those are the conservative measures that apply to most people. Then we have two treatment options. One, because you're in the mild category, is oral appliance therapy. One would be what's called a CPAP machine. So mild and moderate patients, either or therapy is appropriate according to the current guidelines. If you were severe, if you were not breathing 60 times an hour, your treatment recommendation would be at least to trial the CPAP for 30 days. If you're unable to tolerate CPAP at that point, then the oral appliance would be your second line therapy.
And that's a big problem with the CPAP machines, is you're wearing this sort of Darth Vader mask, and it's noisy, and it's just an odd thing to have on your on your face.
And for a lot of people, if they're not able to tolerate the CPAP, a lot of them aren't told there's an alternative therapy that they should be looking at.
Okay, so what are the next steps for me? Obviously, we're going to do for me with the mild case oral appliance. Yeah, so normally what we do is we do what's called a records appointment, where we take impressions, we take the jaw registration position that the appliance will be made in, we decide which appliance design best fits your mouth, your teeth, your jaw, and then we have it manufactured. So there's a records appointment, and then a delivery appointment, and then you start wearing it nightly. Okay, so describe what it looks like and how it fits in your mouth.
So the oral appliances are all two-piece appliances. They hold onto your teeth as doorknobs to hold the door open. So they are custom fit to fit your teeth and your mouth, and they have some way or mechanism in which the upper and the lower portion fit together to keep your lower jaw slightly forward and prevent it from falling back if you do sleep on your back.
Now, this is something foreign in your mouth. You're used to not having anything in your mouth. How long does it take to adjust to this?
It can take anywhere from a few days to a couple of weeks. It depends on the patient. Most of my patients report to me that they are wearing it through the night within the first 3 nights.
So it's normal in the first night to try it half a night, take it out?
Take it out, and most of that will be if you wake up and you focus on it, or it's bugging you, you take it out because you just want to go back to sleep. Right? But the vast majority, now for some of my patients that worry about that, say they're sleep worriers, they wake up and they worry about stuff, or they're already worried about their appliance, they haven't even put it in their mouth yet, we do ask them to maybe start wearing it in the evening while they're awake and start getting used to it in their mouth. Right? The same thing with a night guard or a retainer or anything else they would.
So how do you tell when you're talking? Is it a bit? You talk a bit like that?
A little bit, but you can talk with them in.
Right, and you can take a drink of water.
You can take a drink of water. You can talk with them in. You can sneeze and cough and all those things. Yeah.
So what's the hygiene process with this, like oral care?
That's right. Almost all of them are simply cleaned with either warm water and a toothbrush or warm soapy water and a toothbrush. You can use cleaning tablets on the vast majority of them as well if your tissues aren't bothered by those. So, for instance, Polydent products, they clean with citric acid. So some people get canker sores when they eat fruit or that. So I do caution people, you can try them, that's fine. And what you do is you use them in reverse. So most of those cleaning tablets are for putting partial dentures or some type of appliance in them at night. So you would be putting them in during the day and wearing the appliance at night.
Right.
Yeah, so, there's any number of easy ways to clean them. They're very portable. They come in small cases. You can travel with them. So they fit into the lifestyle.
That's a big
really
bonus for somebody who has a snoring and a sleep apnea, because you have to cart around a CPAP machine.
Yes.
And some of them are getting a bit smaller, but still, this is just something you just throw in your suitcase and that's it, right?
And a number of patients, interestingly enough, even my severes, who maybe really they've been able to tolerate CPAP, they do fine with it, but they want to travel. They want to go on a cruise ship. They want to take a vacation once or twice a year. So they actually have an oral appliance for travel. Now, a number of them do end up starting wearing their appliance at home more and more and more and more.
Because they prefer it over the CPAP machine,
they're not dealing with distilled water and the cleaning process and all of that type of stuff. Or power outages.
Right.
Or I've had a number of people that retired and live on their boat, any number of things.
So from getting the impressions done, the records, to getting the device, how long is that typically?
It's only about 3 weeks.
Right.
Yeah. And they're custom made. They can be adjusted around dental work over the lifespan of the appliance, but we do ask your general dentist to best fit the dental work into the appliance, because we do want to limit any adjustments to fit and retention on the appliances. But if it is covered under an extended health benefit plan, it also will have a replacement frequency. So, for instance, Pacific Blue Cross will replace one every 3 or 5 years.
Now, when I'm guessing I have to do the home sleep test again with this in.
Now, yes, and that's a critical part of the care, is not only are we going to get a subjective report, okay, is that position or the next position effective for the snoring at home, but then we're going to repeat the home sleep monitor with the appliance in to make sure the breathing is also managed.
And then you can make adjustments.
That's right. Yeah. So we're looking for, in your case, we would be looking for a 50% reduction in your events. Yeah.
That's the voice of Dr. Charnel Muir, the SnoreDentist. And the best way to get in touch with you?
A website, which is SnoreDentist.ca.
And you can visit Dr. Muir on the North Shore, but she also travels to the island and to West Broadway. You can't make those appointments online.
No. Right? If you do need an appointment in one of my satellite locations, call the office, leave a message. I can always call you back, and we can try and coordinate that for you.
All right. It sounds like I'm going to be coming in for more visits.
There you go.
Dr. Muir, it's been great having you on the show. And I'm sure there's many people listening to this who have a snore in their life. You might snore yourself, and there could be some other underlying health risks, and it's definitely worth getting the home sleep test done. That's all the time we have for today's show. I'm Zach Spencer. We'll speak to you next time right here on CIL 650.